Seeking therapy from a pastor instead of a therapist can present several challenges and limitations. My name is Marquise Walker. I'm a licensed clinical social worker and the owner of Win Within Therapy Group. Like, share, and comment below. Give me some feedback. What do you guys think? Fun fact, I myself am also a licensed minister. Let's get to the video. Lack of training and qualifications. See, pastors may not have formal training in psychology or counseling techniques, which could lead to a lack of expertise in addressing complex mental health issues. Therapists have specialized training in mental health and psychology, allowing them to provide evidence-based therapies and interventions to address a wide range of mental health issues effectively. Limited scope of practice. Pastoral counseling is often rooted in spiritual and religious beliefs, which may not fully address the psychological and emotional aspect of mental health concerns. Therapists possess a diverse set of skills and techniques to help you navigate through complex emotions, trauma, and life challenges. They can tailor a treatment plan to your specific needs and provide personalized support to promote healing and growth. Bias and subjectivity. Pastors' advice and guidance may be influenced by their personal beliefs and values and interpretation of religious teachings, potentially leading to a biased perspective. Therapists offer an unbiased and neutral perspective on your concerns, helping you gain insight into your thoughts, feelings, and behaviors without any personal or religious bias influencing their guidance. Lack of professional boundaries. Pastoral relationships are often based on spiritual guidance and pastoral care within the religious context, which may blur the boundaries between counseling and personal beliefs. Therapists maintain professional boundaries in their therapeutic relationships, ensuring that the focus remains on your mental health needs and concerns. This can prevent potential conflicts of interest that may arise when seeking guidance from religious figures. Limited treatment options. Pastors may focus more on spiritual support, prayer, and religious counseling techniques, offering a limited range of therapeutic interventions compared to the diverse approach and evidence-based treatment provided by therapists. This could result in a less comprehensive approach to mental health care. Confidentiality concerns. While many pastors uphold confidentiality standards in counseling sessions, there may be variations in how this is regulated within religious organizations compared to the legal and ethical standards followed by licensed therapists. This could impact the privacy and protection of sensitive information shared in therapy. Therapists are bound by strict confidentiality laws, ensuring that your personal information is covered and remains private. This can provide a safe space for you to openly discuss sensitive topics without fear of judgment or breach of privacy. While pastors can offer spiritual guidance and support, therapists bring a different set of skills and expertise to address mental health concerns in a professional and evidence-based manner. Ultimately, the decision to seek therapy over pastoral support depends on your individual needs, preference, and the nature of the challenges that you're facing. With all that being said, a pastor can provide valuable support for your mental health in various ways. Let me share some of those ways with you. Spiritual guidance. Pastors can offer spiritual guidance and counseling that aligns with your faith, tradition, and your beliefs. They can help you explore questions of purpose, meaning, and identity, providing a source of comfort and grounding during a time of spiritual distress and crisis. Emotional support. Pastors are often trained in pastoral care and active listening skills, allowing them to provide non-judgmental support and empathy for individuals going through difficult emotional challenges or life transitions. They can offer a safe space for you to express your feelings and experiences. Prayer and meditation. Engaging in prayer and meditation and spiritual practices with a pastor can promote relaxation, peace, and emotional healing. These practices can help you find strength and a connection with the faith community during times of stress and emotional turmoil. Community resources. Pastors are often well connected within their faith community and may be able to provide information and referrals to mental health resources, support groups, or counsel services that align with your needs. They can help you access additional support and resources for your mental health journey. Encouragement and hope. Pastors can offer words of encouragement, hope, and inspiration based on religious teachings and beliefs. Their message of faith, resilience, and compassion can provide comfort and motivation to navigate challenges, build resilience, and cultivate a sense of hope for the future. Collaboration with mental health professionals. Pastors can work collaboratively with mental health professionals such as therapists or counselors to provide holistic care that address your spiritual, emotional, and mental well-being. They can support you in seeking professional help when needed and integrate spiritual practices with therapeutic interventions. It's important to remember that while pastors can offer valuable support for your mental health, they may not have the same training or expertise as a licensed mental health professional. If you are experiencing severe or ongoing mental health concerns, it is highly recommended for you to seek support of a qualified therapist or counselor support that specializes in your specific needs. Pastors can complement professional mental health providers by providing spiritual guidance and support that resonates with your beliefs and your values. Sense of purpose and meaning. Spirituality often involves exploring questions of purpose, meaning, and identity, which can contribute to a sense of fulfillment and well-being. Having a strong spiritual foundation can provide a framework for understanding one's place in the world and navigating questions that may impact a person's mental health. Social support. Religious communities and spiritual traditions often provides a sense of belonging, support, and connection for individuals, fostering social network and support systems that can enhance mental health outcomes. Feeling connected to others through shared beliefs and values can promote emotional well-being and reduce feelings of isolation. Values and ethics. Spirituality can shape an individual's values, ethics, and moral compass, influencing their decision-making process. With spiritual principles, a person can promote feelings of integrity, purpose, and self-esteem, contributing to overall mental health and well-being. Mental health benefits. Study has shown that engaging in spiritual practice such as mindfulness, meditation, prayer, or gratitude exercises can have a positive effect on mental health, including reducing of stress, anxiety, and symptoms of depression. These practices can promote emotional regulation, mindfulness, and a sense of inner peace. Transcendence experiences. Spirituality can offer a framework for exploring questions about life, death, and the nature of an individual's existence, providing a sense of connection to something greater than oneself. These experiences can foster a deeper sense of purpose, and spirituality growth that positively impacts a person's mental health. It is important to note that the relationship between mental health and spirituality is highly individualized, and what may be beneficial for one person may not necessarily apply to another. It is important for therapists to consider spirituality factors when providing mental health diagnoses. The diagnoses support with establishing a treatment plan and implementing interventions to address the presenting problem. Here are some reasons why a therapist should consider spiritual factors. Holistic approach. Take into account spiritual beliefs, practices, and values allows therapists to offer a holistic approach to understanding individual mental health concerns. Spiritual factors can play a significant role in shaping a person's identity, coping mechanisms, and worldview, providing valuable insight into their overall well-being. Cultural sensitivity. Many individuals draw strength, comfort, and support from their spiritual beliefs and practices, which are deeply intertwined with their cultural backgrounds and identity. By acknowledging and respecting these spiritual aspects, therapists can demonstrate cultural sensitivity and enhancing the therapeutic relationship with the client. Coping strategies. Spiritual beliefs and practices can serve as an important coping strategies for individuals experiencing mental health challenges, offering a source of resilience, hope, and meaning in a difficult time. Understanding how spirituality influences a person's coping mechanisms can guide therapeutic intervention and support effective treatment outcome. Value alignment. Spiritual beliefs often shape an individual's values, ethics, and sense of purpose, influencing their goals, decision-making, and behavior. By considering spiritual factors in diagnoses, therapists can better understand their client's motivation, conflict, and the source of distress, enhancing the therapeutic process and aligning in alignment with the client's values. Meaning making. Exploring spiritual beliefs and questions can help individuals make a sense of experiences, finding meaning in adversity, and navigating life transitions. Therapists who consider spiritual factors in diagnoses can support their client in exploring concerns, challenges, and finding a sense of purpose and connection that contribute to mental health and well-being. By recognizing the importance of spiritual factors in the diagnostic process, therapists can provide a more comprehensive and culturally sensitive care that respects the diversity of spiritual beliefs and practices while addressing the complex interplay between spirituality and mental health. If you find that your therapist does not respect your spiritual beliefs, it is important to address this issue to ensure that you feel understood, valued, and supported in the therapy process. I appreciate you for watching the video. Please like and share your comment below. I'm really curious as to what you have to say regarding the topic. But I want to encourage my fellow pastors. I want to encourage you guys to continue to broaden your knowledge, continue to learn all you can about what you can, and continue to grow. Don't ever stop growing. As the good book says, all thou getting, get an understanding. It also says, study to show thyself approved. To all my fellow therapists out there, I want to encourage you to practice cultural humility, practice cultural sensitivity. Just because you can read a book about a certain group of people don't mean you know anything about that group of people. Thank you for watching. Daddy, ready? Nah, son, I think we gonna kind of stay home for a little bit. Yeah, I think we're gonna stay home for a little bit. Really? Why we ain't going to church, Daddy? Well, son, they might not really like what I say for a while. Now, Daddy, when have you ever cared about what people be saying? You always told me people gonna throw stones regardless. You know what, son? You right. I done taught you something, huh? Because with preaching, you just preach the gospel and people either take it or not, right? Yeah, we're gonna go to church. I'm gonna get ready. We're gonna be a little late, but I'm gonna go ahead and get ready. Go tell your mama. I'm gonna be a little behind. This time it's not her fault. All right, Daddy. Daddy be tripping sometimes.